and then I'll get us started. So it'll just be a second, guys. All right, everyone, we're live on YouTube. Oh, Kevin is about to join us, and it says Kevin. Okay, I think everyone is here, and we're live on YouTube, so I'm going to go ahead and get us started. Thank you, everyone, for joining us today on Monday, May 11th. For the record, there's snow on the ground, and it seems particularly unfair. Hopefully not for the next briefing. Today we have statements from Acting Medical Officer of Health, Dr. Hsiu-Li Wang, and also from Regional Chair Karen Redman. We also have Mike Murray, our CAO, standing by to take any questions. So with that, I will pass it over to Dr. Wang. Go ahead, Hsiu-Li.
Thank you. Hello, everyone. Thank you for coming. So sadly, we continue to see COVID deaths in our community. To date, 103 people have passed. Again, I wish to express my deepest condolences to all the families, friends, and caregivers who have lost loved ones to COVID-19. There are currently 12 long-term care or retirement homes in outbreak, 17 outbreaks in long-term care and retirement homes have been declared over. 493 people have now recovered from COVID-19 in our community. While community spread appears to be slowing down, and a number of outbreaks in long-term care and retirement homes are well controlled and or being declared over, our gains are still precarious. COVID-19 is still a significant threat. And if we are not careful, cases and outbreaks could rapidly escalate again. That is why, as Ontario is very slowly starting to lift restrictions, we need to be very careful and proceed very cautiously. By and large, we need to stay the course. We still need to avoid gatherings, maintain physical distancing, wash our hands diligently, stay at home when we start to feel sick, even when mildly so. And for now, continue to limit the number of times we go out. In addition, the general public can consider the use of non-medical masks, such as cloth masks or face coverings, especially if they find themselves in situations where they may not be able to maintain physical distancing from others. You have to be careful with masks, though. You have to be careful. It does not lead you to increase the number of times you touch your face, such as to adjust or fiddle with your mask. You need to practice diligent hand washing before and after manipulating the mask. You need to also be careful that it does not give you a false sense of security. Non-medical masks can be an additional tool in the toolbox to help prevent the spread of the virus, because wearing a mask can help you contain your own droplets. It's analogous to coughing into your sleeve or coughing into a tissue. So it can help protect others, but it cannot be relied upon to protect you from COVID-19. So it cannot replace in any way the public health measures that I mentioned earlier. So As we gradually lift our measures, people can consider this additional measure, especially if they find themselves, as I mentioned, in situations where they may not be able to maintain physical distancing. Finally, please remember that medical grade masks and respirators must be reserved for healthcare providers. In closing, about 2 months ago, we began to see public health measures put in place to fight COVID-19. This was a new way of going about our lives and has been a most difficult period for many. In those 2 months, many residents have fallen ill, some seriously, and most sadly, several of our community members have lost their lives. And there has been the undeniable economic fallout that has impacted many. But as we enter the 3rd month of our measures, we must take hope. We must take hope in the knowledge that our collective actions have saved lives, that our collective actions have allowed our healthcare system to cope, as well as to be able to redeploy extremely needed resources, such as from the LHIN's home and community care and from the hospitals to long-term care and retirement homes, who have struggled greatly to help stabilize these homes. So I urge you to continue to follow public health measures as the province very slowly lifts restrictions. As I mentioned on Friday, if we continue to work together, we can hold on to the important gains that we have made as a community. We cannot move too fast, or we will be forced to backtrack and suffer greater health and economic impacts. So thank you so much for continuing to do all that you can for our community. Thank you.
Thanks, Dr. Wang. So now I will pass it over to Chair Karen Redman. Go ahead, Karen.
Thanks, Bethany. I want to assure regional residents that we're working hard to continue providing essential services during COVID-19 to get our residents through this crisis. We're turning recreation centers into homeless shelters, providing transit to essential workers, and we're coordinating emergency childcare for our paramedics and other essential workers in our community. Our public health staff are working around the clock to keep us safe. We're committed to keeping essential services running when people need them most. This is why I sent a formal request to our federal government on behalf of Regional Council, asking for financial assistance moving forward. Our revenues are plummeting and our costs are rising as we manage this pandemic. Municipalities cannot run deficits, and we know that this is not a time to cut services. We asked for immediate action to protect our most vulnerable populations. We want to see them implement the emergency operating fund that the Federation of Canadian Municipalities is calling for on behalf of municipalities countrywide. We're doing all we can on our part to get through this, and I'm proud of how the region's municipalities, businesses, healthcare partners, and citizens have responded. Thank you.
Thank you, Karen. All right, I will pass it over to members of the media for questions, and we will start today with Fee. If you're ready, Fee, go ahead.
There we go. This is to Karen Redman. Just what's the update on our current deficit that we're running? Like, how far in the hole are we?
So, Fee, right now, our current revenue shortfalls are about $4.8 million per month. And that is accountable for the less transit fees, waste tipping fees, housing rent, childcare fees, planning application fees, airport charges, museum admissions, and provincial offenses revenue.
All right. Yeah. That's the only question I had on the top of my head. Okay.
That's fine. Thank you, Fee. I will move on and pass it over to Bill from the Cambridge Times. Go ahead, Bill.
Thank you very much. My question is for Dr. Wang. I was wondering, looking at the dashboard, the numbers for travel has gone up, not significantly, but it's gone from 36 and it was holding steady to about 40 now. Is there any reason for that increase?
No, it's not surprising. It can fluctuate a bit. People are still allowed to travel. They're advised not to if they don't have to. And of course, when they come back, they need to self-isolate as per the Quarantine Act for 14 days. But, you know, they can still, as we see, get it from traveling, which is one of the reasons we're recommending that they not travel if they don't have to.
Is there a worry though that there might be a spike at this, or is this maybe just a blip on the radar?
It can be a blip. It's hard to make any, you know, judgment from day-to-day numbers, but it's something obviously we're watching.
Okay, thank you very much.
Thank you, Bill. I'll pass it over to Kate from CBC. Go ahead, Kate.
Thank you. This is for Chair Redman. I'm hoping my dog doesn't bark. What kind of conversations have you had with Minister Clark about allowing the municipalities to maybe go into deficit for a limited period of time, or changing that law that prevents you from doing that?
So I wouldn't say that we've spent a lot of time talking about that, Kate, to be quite honest. Municipalities are, as you know, legislatively not able to go into deficit, and I don't think municipalities want to run deficits. So we're talking to both the provincial and federal levels of government to say we need financial relief. And there's always been a sense that we are now providing services at the municipal level that the tax base was never created for. We have income from fees. I talked about some of the revenue shortfalls that are really the only tools, that and municipal property tax, that we have at our disposal. So we continue to talk to senior levels of government, you know, on the same sort of line of reasoning that we've had for a long time, and that's that we need another source. The federal government has provided some gas tax relief. The Federation of Canadian Municipalities is saying that that is really a good mechanism to have, but we need more financial resources because property taxes simply cannot support the services that we are providing.
And if Karen, do you mind if I could just add a little bit to that?
Yep.
Yeah, I totally agree with what Chair Redman said, and I think municipalities generally are not looking for the ability to run deficits because if we run a deficit, we need a path out of the deficit. And so, you know, if we created a big hole for ourselves, one of the questions on everybody's mind is, well, how would we ever dig out of that hole? And really, with the sources of revenue that municipalities have, there would be only two ways to dig out of that hole. One would be significant increases in property taxes or significant reductions in program spending. So that's the real problem with this idea of, well, just run a deficit. Unlike federal and provincial governments, we can't borrow money to finance that. And we don't have revenue sources that grow with the economy. So the exit from the deficit would be intensely challenging for municipalities.
All right, fair enough. Dr. Wang, I wanted to ask, over the weekend, we saw West Hill had added a case. They were added to the active outbreak list. Mm-hmm. We haven't seen them before. Like today we saw Westmount added back, having had a case in a resident. The case at West Hill is a case in a resident. Is it concerning to you to continue to see new cases in long-term care homes?
No, it's actually a sign that we're picking them up. I expected, you know, I expected that there would continue to be cases in long-term care homes and retirement homes. So what I'm glad for is that we're picking them up early. You know, we still have circulation of this virus in the community. And so we can expect that we can still have cases show up in long-term care homes and retirement homes. So really, the priority right now is to continue to pick them up early so we can put them under outbreak measures quickly. And yeah, and so that will really help to control them. So yeah, we just have to be very vigilant right now for long-term care homes and retirement homes.
And I just also wanted to ask, on Friday, there was talk about how Ontario is seeing an increase in community spread. Now, on our dashboard, it looks like it's still sort of remaining around that 22%, maybe up to 25 it's been. Are you at all concerned about community spread rising in the region?
Yeah, no, that's a really good question, Kate. So we're still, having relatively slowed down community spread. But I've heard about that happen elsewhere in Ontario. So we're going to continue to monitor that closely. For sure, as we start to lift restrictions across the province, this is something we can see, and which is why we have to be really careful with respect to the speed that we lift restrictions and with monitoring what the impacts are. So we'll have to remain vigilant on that.
Okay, I'll stop there for now. Thanks.
Thanks, Kate. All right, I will pass it over to Damon from the Woolwich Observer. Go ahead, Damon.
Okay, so my question is for Dr. Wang. Some of the retirement homes and long-term care facilities are allowing people in after a screening process to visit family members that might be in like palliative care. What stance does public health take on this? And do you think this could be part of the increase that we keep on seeing in these homes and facilities?
Oh, thank you for the question, Damon. So long-term care homes and retirement homes are allowed to allow in essential visitors, and that's been the case for a while. I think it's important that that they still continue to be allowed in. However, as you mentioned, they are being screened, and that's the important thing. And we have heightened surveillance in all these homes to pick up cases very quickly, as we're seeing. So I don't think it's actually leading to an increase in cases. I think that what we're seeing in terms of number of cases, I think what we're seeing is homes continue to be detected with cases, but that is a sign that is the result of us monitoring more closely those homes. So I don't think it's an expression of an increase. I think it's a sign of the very significant monitoring that we're doing for these homes right now. And so I'm glad we're picking them up, actually.
So the screening process, would this be the same as all the staff would go through for these family members? Okay, perfect. That's my questions. Thank you.
Thanks.
Thank you, Damon. All right, I will pass it on to Joanna from the Record. Go ahead, Joanna.
Thank you. Just a couple questions for Dr. Wang. Is public health working with any other employers besides Conestoga Meats that are dealing with an outbreak?
With an outbreak?
Yeah,
No.
there are cases.
No, with a workplace outbreak, no. We are getting, even as I speak, cases that are coming in that are being assessed by our nurses. And, if we see signs of a workplace outbreak, then, we would contact the employer. We would work with the Ministry of Labor, etc., to look into the situation. But no, we're not working with another employer at this time related to a workplace outbreak. But there can be cases that are detected among workers. That doesn't necessarily mean there's an outbreak. We assess whether or not there's evidence of spread that's actually happening in the workplace, as opposed to, for example, spread that can happen amongst workers, but that we believe is due to them having acquired it outside the workplace.
Okay. And I guess sort of two related questions. You mentioned wearing the masks earlier, which is the first time you really talked about that. And also anecdotally, I'm hearing over the past few days that people are a lot of people are acting like this is kind of coming to an end. they're out more, they're like kind of resuming their normal shopping. And are those related, or are you concerned about people relaxing these measures and sort of acting like it's back to normal?
Yeah, no, those are excellent questions, Joanna. You're right that the advice with respect to masks has been out for a while from the Chief Public Health Officer of Canada, and I did want to emphasize it today because we are starting to lift restrictions in Ontario, and I wanted to sort of remind people this is another option that they can take. And, I do think it will be important for people to really continue to take the measures that we're recommending as we're slowly lifting. It's going to be a delicate balance, right? We want to make sure that as we slowly lift measures and the economy starts to run again, we are still able to keep disease transmission rates low. And so people need to follow those public health recommendations that we've talked about. And masks, the use of non-medical masks, is another tool in the toolbox that people can consider, especially as there's more people out there now and people may not be able to always physically distance from others. If they find that they could be in those situations, then I recommend that they consider the use of non-medical masks. That said, I did express some precautions about the masks because, if they're not taken and, for example, people put them on, but they don't wash their hands or they fiddle with them more than they should, then the masks can actually be a source of spread. So they have to be very careful with that as well, like I mentioned. But overall, yes, would like people to continue to take those same public health measures we've always been talking about. And with the lifting of restrictions, also consider the use of non-medical masks in situations where they may find themselves unable to physically distance from others.
All right, thank you. Those were my questions.
Great, thanks, Joanna. We have, I believe, 2 more reporters, so I will pass it to Nicole from CTV. Go ahead, Nicole.
Thank you. The KW Food Truck Group says they got the green light to open today from Public Health, but in Toronto, John Tory said this weekend that food trucks cannot open because the province has classified them as non-essential. Did Waterloo Region Public Health give local food trucks the go-ahead to begin operating?
Well, thank you for the question, Nicole. So we created guidance for food trucks in order to support them as operations for takeout, right? Because they're allowed to operate as takeout establishments. So this guidance can be found on the public health website. So we have advised food truck operators that only one food truck can operate per parking lot or in close proximity, so that we avoid crowding or gatherings. Physical distancing measures must still apply. And no tables or chairs can be set out, as food trucks must only operate, as I mentioned, as takeout establishments. So hopefully that answers your question.
Yeah. Hold on, I'm just gonna scroll down. I guess this may be for Mike Murray. Ontario's deficit has quadrupled because of the pandemic, and they say they have no way of knowing how much bigger it will get. What conversations has the region had with the province about planned infrastructure projects that are now canceled or delayed because of this?
So I would say from a senior staff level, we've not had any conversations with the province about canceling any provincial infrastructure funding. And I know that I'm going to refer to Chair Redman. I know that there's ongoing discussions between AMO and provincial ministers about infrastructure funding, infrastructure stimulus funding. You know, it's all part of what assistance can federal and provincial governments, A, provide to municipalities, but B, what can they do in terms of infrastructure stimulus to quickly actually stimulate the economy as part of the recovery phase. And we've shared some ideas with them about what we think we and other municipalities would be able to do relatively quickly in terms of ramping up infrastructure programs. One whole area of idea is affordable housing. We think it would be entirely feasible and appropriate for the province and potentially federal government to create some sort of housing infrastructure stimulus program that could be ramped up really quickly using existing programs. We think there's capacity in the residential construction industry, and it would solve multiple problems, create multiple benefits. Chair Redman probably wants to add, given some of her discussions.
Thanks, Mike. Yeah, just to add on to what you're saying, I would have to say that we've indicated that we are able to go forward with the projects through the tripartite funding, the IKIP between the federal, provincial, and municipal projects. So we're still ready to commit to those. However, we've also indicated that we have other shovel-ready projects, some of them being in social housing, as you've mentioned, Mike, and that we're happy to be part of a quick start for an economic stimulus, but to come back to municipalities at this juncture with a cost sharing ratio that would be a third, a third, a third. We are bleeding money, as I've already indicated, $4.8 million per month. We have increased expenses as well during the pandemic. So there will have to be a different financial arrangement, because we're happy to animate the economy. We feel we're in a really good position as municipalities to do that, but we are not going to have the financial capacity to come up with the 1/3 of the project funding, which is what has historically happened in these cost sharing projects.
Okay, and I have one more question. Now, other public health units in the province have provided testing for the general public sooner, despite the guidelines from the province saying it wasn't necessary. Why did you decide to wait, and when will you provide an update on testing for the general public?
Yeah, no, thanks for the question, Nicole. So testing is overseen by our clinical partners who do the testing. And, you know, the model that has been in place has been the one that they have felt was what we needed in the province. Sorry, what we needed regionally, especially as, you know, we were experiencing limitations on swab supply, and also limitations with respect to lab capacity, which isn't uniform across the province. So they felt that that was, you know, the best approach at the time. As I mentioned on Friday, we are working hard and have continued to work hard with our local partners to put in place a plan to open up testing to the general public as soon as feasible. So I don't have any updates about that today, but I hope to be able to provide updates as soon as feasible on behalf of the testing partners.
Okay, that's it. Thank you.
Thanks.
Great, thanks, Nicole. And I will pass it on to, I believe, the final reporter, Kevin from Global. Go ahead, Kevin.
Morning. So I guess my first question is, have there been any more employees of Conestoga Meats test positive?
Thanks for the question, Kevin. So we're continuing to assess results as they come in. You know, I should have an update. You know, I should have, when we have another update to provide, I will be providing it. We're continuing to assess the results that come in, and you know, assessing whether or not there could be links to the plant in terms of transmission. It's a complex issue because there's a lot of social interaction among employees outside the plant as well. So we, you know, when I will be providing an update when I have another one, but I don't have one at this time.
Sounds good.
Thank you.
So the province lifted some of the restrictions on provincial parks today. Is there any way we're headed in that direction here soon?
I'll maybe leave that question to Mike Murray.
So what I can tell you is this is a subject of discussion with the area municipal CAOs who have municipal parks, as you know, and they're really actively looking at what restrictions could be eased in municipal parks. Unlike some of the provincial parks, municipal parks have continued to be open for sort of passive recreation, walk through traffic. What's been closed are playgrounds, skateboard parks, areas with surfaces, areas where people congregate, dog parks, for example. So many of the provincial or many of the local parks have remained open for walking, enjoyment, travel through. But the municipalities continue to look at what, if anything, more can they do, especially as we continue to hope for better weather and a long weekend coming up. So I would say stay tuned on that.
Okay, last question. Just to clarify, that 4.8 million number, is that not counting? Is that including the amount of savings we would have by not running as many buses and all other sort of things, or is that above and beyond?
Karen, do you want to go? Or do you want me to go?
You go ahead, Mike.
Yeah. So the number that Chair Redman referred to, 4.8 million, is our revenue loss. So we're losing $4.8 million of revenue per month. We have some offsetting savings in terms of staffing costs, fuel costs, other costs because of either layoffs or program scaling back transit service, for example. So the net monthly loss is somewhere in the range of about $2 million per month.
Okay.
But Kevin, if I can just add, we also have increased costs in other areas. So that may be on sort of that line of lost revenue, but we're also having increased costs for housing, income support, discretionary benefits, and homelessness. So some of those are receiving, or we're hoping will receive, funding from the federal and provincial governments, but there are areas where we are incurring additional cost. And
you're getting a tag team here. I'll add one other thing. So everything that Chair Redman and I just gave you, those are, kind of ongoing regular costs and revenues that we're monitoring. In addition, there are sort of one-time kinds of revenues or costs, but it's not clear yet. Like, so for example, every year the region gets a certain amount of supplementary taxes. These are properties that come onto the tax roll during the year after we've established our budget. We get development charge revenue, as you know, from new development. And so there's a whole number of revenue sources that are highly uncertain right now. So the numbers that Chair Redman and I gave you, those are sort of recurring, ongoing monthly costs that we're trying to figure out what the costs are doing and what the revenues are doing. But in addition, there are a number of other variables that we're trying to track, but it's really hard to do at this point in the year. But there's risks on the horizon for the region for sure.
Okay, thank you.
All right, thanks, Kevin. I'm going to just pause briefly to see if I missed anyone or anyone has any other questions. I can see Kate waving at me. Go ahead, Kate.
Thank you. I have two quick questions that I hope will be quick answers as well. There was the plan to open a space for people who are homeless in Cambridge, and I'm wondering if we can get an update on how that is going and if we have a space for it, because there wasn't a space for it last week, I think.
I would say it's a work in progress.
That is a quick answer. And also I noticed on the regional council agenda for tomorrow, there's talk about reintroducing transit fares as of June 1st. Can you kind of go through why June 1st was chosen as the date for that?
part of the reason June 1st was chosen is because we had free fares running until May 31st. And so we need a plan post May 31st. And our plan is to try to get back to fare service. You'll recall part of the reason for, there were a couple of reasons for free transit. One was going to rear door boarding on our buses to try to create a safe environment for passengers and for operators. So we are now putting in place other measures to try to create a safe operating environment for our operators and our passengers that we believe will allow for safe front door boarding on the buses. And so we're now able to collect fares on the buses. So that was one of the big reasons for going to free service. The other was just a recognition that, you know, frankly, people are having a pretty challenging financial time. And we're now starting to see gradual reopening of the economy, gradual reopening of some retail. You know, we think that the 2 months of free transit service, we think was a helpful gesture, was appropriate in the circumstances, and it's appropriate to find an exit strategy from that.
Are you able to get into what the other measures are for operators? Like, is it just putting up plastic beside them?
I think actually, Kate, I'd refer you to that report because I think that report covers off a little bit of that. I'd have to go and look myself.
You want me to read it? Okay, thank you. Those were my questions.
Kate, we can follow up and highlight some things for you if that's helpful. Okay, I'm just taking one quick look. Oh, I see Fee waving at me. Hi, Fee. Would you like to ask another question?
Yeah, just one more quick question to Dr. Wang. Yeah, a lot of the provinces are starting to reopen again. There's the fear of a second surge. My question is, do we have any plans? Our current plans for a contact tracing is I'm sorry. What our current plan for contact tracing is and whether it's been updated in the past few days.
Hi, Fee. Yeah, thanks for the question. So you're right. It will be important as the economy continues to slowly open up that you know, we increase some measures to try to make sure that disease rates stay where they are and don't increase. So we are scaling up our ability to do case and contact management. You know, we've always been doing case and contact management, but we are working to be able to do even more of that as the you know, restrictions start to lift. It's an important tool in the toolbox, but it's not the only tool, right? You know, case and contact management is trying to follow up with people who may have already been infected or have already been infected, may have already been exposed. So it is something that we do as a follow-up after infection and exposure has occurred, as opposed to something that we would do to prevent infection and exposure from occurring. So those measures about physical distancing, for example, about, you know, those other measures that I've mentioned, they're important measures in order to try to reduce the actual spread of the infection. So it's a combination of those measures, of reinforcing all those measures all around, including case and contact tracing, including testing, et cetera, and enhancing it further as we continue to open up the economy. It will be a delicate balance. We need to continue to monitor the situation closely and you know, see how it evolves.
Any consideration for the use of apps in this?
I'm sorry, the use of what? The use of apps. Yes, you know, yeah. Thanks for the question. So we are monitoring that information. However, we do know that the province is actually looking into it specifically. We know that there's been apps released in other jurisdictions, for example, in Alberta. There are important privacy considerations and things like that. And so the province is taking a look at it for the province as a whole, which will be helpful because, you know, for an app to work well, you do need to first ensure that it's, you know, likely to have the intended effect. And second, it will be more helpful if there's more people using it. And so a province-wide implementation, you know, would be ideal if we were going to go there. You know, we continue to take a look at this, but you know, for now, we're continuing with our usual case and contact tracing and management.
All right, thank you.
Thanks, Fee. Okay, I think that's everyone. Last call. Thanks again, everyone, for joining us at our media briefing, and we will likely see most of you again on Wednesday, and we appreciate your help sharing these messages. Thanks again, guys. Bye-bye.
See y'all.
Thank you very much.